Good afternoon. This is Dr. Nivedita working as urologist, part of SIMS Hospital She Clinic. Today I want to discuss with you something called a urine leak, about urine leak. So urine leak is a problem which is right from the newborn child to the ripe old age. So let us describe about it. So today I want to talk more in details about the patients who are nearing menopause or postmenopausal, because they are the ones who are really suffering with these problems, the problem of urine leak, which we are all unhappy about. Basically, I would like to divide it into three categories. One is called an overactive bladder, which presents to us as urgency. The other one is a stress urinary incontinence, and the other one is a overflow incontinence. So I'll just describe about what these three types mean to us. One is overactive bladder, means the bladder works then more than what we want it to work. So in that case, what happens is it starts passing urine or taking out urine before we know it, before we want it. In that case, the urine starts leaking and our clothes get wet and we get embarrassed, and because of that, it's a problem. So how do we treat it? Basically, we start with some medications, find out the reason for it, and then progress to even surgeries if required. So we'll find out the cause and we can solve it easily. The second problem which I was telling you is about a stress urinary incontinence. What that means is, even while coughing, laughing, sneezing, these are all common things which we plan to do in daily life, right? So even this can lead to some urine leak, and that will embarrass us and maybe restrict us from doing all these things. So for these problem, we can solve it by using some exercises which we can teach. It can be done at home. You need not go for a gym exercise to solve all that. You can do at home very simple exercises. The next step can be some medications which can also be taken. And the other step finally is a surgery. That is also a not major one, and we can solve a problem very easily. The third one which I was talking about requires some more medical attention. That is something called an overflow incontinence. So it's basically an overflow. So like as example, the bucket is full, that means you cannot control the water. So your bladder is full. So you are leaking urine because it cannot hold more than that. That's a condition which needs some medical evaluation of why it is happening. The causes maybe you may have some stones in the bladder because of which you are not able to hold urine. You may have some severe infections. You may have some neurological problems, or you may have some problem of the outlet obstruction through which you are not able to pass urine. All that may require some treatments ranging from medications to some minor procedures also, and the conditions as when they are caused to correct the conditions so that they are also corrected. All these are all very simple, and they just need some basic investigations and step-by-step treatment for all of these conditions, which can lead to your normal life. So the urine leak, why we are so much bothered? There are two aspects to it, that's what I would say. One is the medical one, because the problems, if persistent, they can lead to even kidney problems later and all. So for that, we have to really pay attention and take care that they don't lead to a long-term damage. The second thing is the quality of life. That is very important, because of these urine leak problems, you may restrict your life. As simple as that. You may not want to go to a cinema, you don't want to go to a long travel. All these things you will yourself be restricting. So all these things can be avoided, and you can have a normal and happy life also. We are there to help you. That's what I want to tell you. Thank you.